Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Derek Moss. He's a pediatrician, and his Kevin MD article is How Natural Disasters Reveal Resilience and the Power of Community. Derek, welcome to the show.
Thank you.
All right, so tell us a little about the article that you wrote on Kevin MD and the story that you shared.
So I was actually on vacation. I was in Colorado and the fires in LA started, and I sent a text to my friend, a friend of mine from middle school and high school, to ask how she was doing. She also happens to be an editor of Socalo Public Square, which is an online publication. And she just like casually said, "Would you want to write?" Like one of her fellow editors is coming up with this idea of letters to LA with other ideas of, people who've gone through natural disasters to send a letter to LA. So I don't know if she thought I was going to write the letter. I think now, like looking back, I've tried to like edit and do some other stuff and get so busy practicing medicine, the time to, and energy to be able to do that is difficult. So I think it was kind of lucky I was on a break, so I was able to kind of go back and forth with her and edit it. So
Sure, sure.
yeah.
And in your article, you talk about your own brush with a natural disaster, your practice, and the Hurricane Helene disaster in North Carolina. So tell us about your article.
So I think like it's kind of interesting because some of the parts, I wrote probably more on that article that got edited out, probably because it got too wordy. You can get a little wordy when you start
Sure.
writing these things. And I think like, I mean, just when you go through something, I think like the closest thing was like Hurricane Katrina. And it's like we all knew that was bad, but it's very different living through this. And also I remember like reading stuff with Katrina, just how long it took for help to come.
Mm.
And I think that is the main thing. Like it was, I mean, I don't think it should take, it was 1 week shy of 4 months when we had our first insurance payment.
Wow.
I mean, that's a long time to try to get your business back afloat. Yeah, it's very difficult.
What was your
Um,
practice like? And tell me about the disruption that Hurricane Helene wrought on your practice.
yeah, so we have two offices, one in Hendersonville, North Carolina. We're about 25, 35 minutes south of Asheville, about an hour or so north of Greenville, South Carolina. We have two offices, one in Hendersonville and one in Brevard. And the flooding really hit just one office. It was the main office in Hendersonville Pediatrics. In that office, every day we had like four doctors working. We saw about 100, more than 100 patients a day in that office. And then you're like scrounging to try to find places. I mean, we had another office, so we were able to see some of our patients in Brevard, but it definitely Brevard is only so big. That office is not very big, so we had to find places in Hendersonville too, and just how difficult that is.
And in terms of all that flooding, was it a total destruction of your office? How long was that office out of
Yeah,
commission
so
for?
it was the bottom floor. We have a little bit of a second floor, but the bottom floor was 5 feet in there,
Wow.
and they took out all the drywall. I mean, it was down to the studs and the concrete slab.
So, as you were scrambling to move patients around and finding places to practice, just talk about the disruption it had for those 100 patients a day that you would see normally in that office.
Well, I think at the beginning, so many people had such a hard time just traveling anywhere that I mean, we weren't getting that many. I mean, even in our Brevard office, we were seeing maybe 15 one day, and then maybe 30. I mean, it started building up, but I mean, people couldn't get out of their homes. I mean, they were worried about their own families. So initially, maybe there wasn't such an emergent need. People would go to the emergency room as opposed to calling us. But we definitely wanted to find a space to start seeing patients. And so I mean, local hospital like showed us some space, but you don't really think like space for physicians. I mean, you need an exam table, you need like
Yeah.
ability to wash your hands, you need your everything labs, swabs. I mean, everything's gone, and you're like, whatever you're looking for does not have what you're looking for or what you need to completely see, to see a patient where with
So,
standards that you set for yourself.
so take us into some of those patient encounters. Like you said, you didn't have your normal workspace. You didn't have a lot of equipment. You pretty much had yourself, perhaps some staff members, stethoscope. So tell us some of those patient encounters in a completely unfamiliar scenario without a lot of equipment.
So the first, I mean, I felt like we were pretty fortunate. Like that first week, we were able to kind of get this place at the free clinic. So there was a little bit more of stuff, maybe not our lab equipment. I think people were just so happy that they could see us.
Yeah.
So our patients, I think they're very loyal to our practice and they appreciate what we do. I mean, pediatrics are maybe a little different with internal medicine in the sense of, these are parents that are, worried about their children and we give them a lot of reassurance and help them, raise their children. So they're so appreciative. And then for us just to have that space to be able to see them. So I think they're very understanding. I mean, there was a lot of times of us like, we'd have to refer to an outside lab and do a lab order. So then they'd have to go somewhere else, or with immunizations, we'd have to send them to the health department. I mean, that lasted for several months. Like that should have, another thing that I thought should have turned around pretty quick, but it's a lot more difficult, all the paperwork that now we have to go through.
What about things like electronic medical records that you couldn't normally use on your standard normal computers?
Well, we lost some computers. A lot of people like myself had mine at home. So as far as with our EMR system, we were able to get on, but we did have to buy a lot for our staff, people that had left stuff at the office. So, but I mean, I guess that's one nice thing with EMR, is we were able, I mean, we've been on for over 20 years that I've been here. We've been on for over 20 years with some kind of system. So that's nice that our records are in a different location.
Now, how long did you have to deal with these temporary circumstances?
I mean, we're still, so that first place that I mentioned, the free clinics, we tried to get two physicians in there, but we couldn't. And then the Blue Ridge Health, which they rented us a space, so we have two doctors there. I mean, but there's 6 rooms. Like usually we have 4 rooms per doctor, which I mean, when you have 3 rooms, you get kind of bottlenecked at times. So I mean, they're working in our office, but we won't. They said like summer, so we won't be back to our office until July or August. I try not to think about it too much because it's probably gonna be longer than that. But yeah,
So you're anticipating almost a year outside of your normal
hmm
office. You
that's
mentioned some of the behind the scenes challenges like waiting months to get an insurance payment. Tell us about some other behind the scenes challenges that your staff faced during this time.
yeah. And hmm, I mean, I don't know. Our staff did amazing. I kind of mentioned it in that I could have named all the staff and all the stuff
Yeah.
they've done because I mean, I probably should get them on this call because a lot of stuff they did, setting up our labs, setting up vaccines, setting up our office. I mean, they did it all. I mean, they did have some input from us, but I mean, we definitely had employees that went. I mean, they're loyal to us too. I mean, what we do, it's interesting. We chose this field to go into, but yet, our employees, for us, they really support us to be able to do that.
Now, is your practice, is it a private practice? Is it a hospital owned
It's
practice?
it's pri it's a private practice. Yeah.
So you were doing this all in yourself, and there's no playbook for kind of managing through a disaster. So what kind of guidance did you have? Like, how did you know what to do
No,
next?
I mean, that's interesting. Like we actually have a new doctor who's with us for like a week when this happened. So it was like he didn't know what we were going to do. And he asked me one time, comparing it to COVID, and because I mean, that wasn't that long ago and how disruptive that was. But then I think one of the things is everyone was going through that at the same time,
Yeah.
where this was, my friends are medical school friends or whoever, my family. I mean, they're back to, their usual life, so we're not, so that was different. You also felt like you were going to be supported financially, which with here, you do not feel that way. It's every day my office manager sends us, how much money's in the bank accounts, like, and how many patients we're seeing because it's definitely, made us I mean, pediatric overheads like greater than 65%. You get hit like this and it's up to 80, it's so you got to kind of keep your head above water with the money for sure, which I mean you always do when you run a business, but it's a different level than what we're used to.
Now, what about things like reimbursement from health insurance companies, and were they disrupted during this time?
That was, yeah. I mean, it got disrupted because we didn't have the encounters. I mean, one thing I was surprised about, and I didn't write in the article, but then I thought about it later, was that I was kind of, I mean, we've had like stabilization payments from different insurance companies. I mean, they're not huge sums of money. And then the North Carolina Medical Society, I mean, they gave us $100,000, which I mean, I don't know what we would have done without some of this stuff, really. I mean, we would have been in the negative. I mean, we have a pretty good relationship with First Citizens, our bank, but it's, yeah, nice to not have to worry about that because of that, you know. So,
So, in your article, you talked about how your community really banded together. So, tell us more about that. Tell us some of the stories that you could share about your community banding together after this
it
disaster.
it is, I mean, because you kind of collect those as you go along. Like, you know, you hear, like I said, you hear so many different stories. I mean, but I mean, we had no power here for weeks. I mean, no, I mean, the phones would come on and off. You'd have 3 days, you wouldn't even have any cell service. I mean, it was really something around here. And we would leave just to be able to get cell service, hot water, you know, it was so then, you know, you're talking to friends and because you're just kind of dealing with, I mean, we're worried about our office and our, you know, our own family. And but then you start hearing stories and I mean, we have one of our friends in Fairview. I mean, they lost their house. I mean, they saw, I don't know if how much you read the story to this Craigstown where all this family members passed away. I mean, they know all of them,
Mm,
you know, and then we have a lot of our patients who live like, I mean, it's always people always laugh about Bat Cave, but that's a real place. And I mean, they were, I mean, I had three different families who were like helicoptered out of their houses, you know, and they have
wow.
like three and four kids, you know, and they're all getting on helicopters to get because there's no way the roads are all gone to get anywhere, you know, and that's a whole thing because I think about my business and losing our office, which has been horrible, but I mean, we didn't lose our house. You know, there's people
Yeah.
who've lost their whole house, you know.
Now, this was in the context, of course, of the LA fires. Now, whenever a natural disaster happens, it often catches a lot of people by surprise. It happens very, very quickly. Now that you've gone through this and are still going through this, what kind of advice do you have for other clinicians to prepare themselves against an unexpected natural disaster?
Yeah, that's hard. I mean, you definitely rely, like I said, on your staff and the people that you're around. I don't know how. I mean, it's such a shock to the system, like you said, like you worded it very well because it's I mean, you're not expecting that.
Yeah,
I mean, who's like in the mountain thinking like all these flooding, right? They're not thinking like, oh, we're gonna have all this flooding and huge amounts of water that's gonna just destroy all these places. And I think it kind of depends on what kind of natural disaster we're talking about. I mean, the fires yeah, it is a natural disaster. Like people can say, "Oh, there's fires in California. Why wouldn't you expect that?" But you're not expecting it to affect
yeah,
your houses and all these people and their lives, and you hear about it happening in other places, so you know it could happen. But then in reality, it happening is how do you prepare for
yeah,
that? I mean, I think the thing that you kind of learn from this is, I mean, one thing I think about with my article is like, I mean, we need better things in place to be quicker. You know, it's I talked to my some of my insurance friends. I mean, they used to have a checkbook and they'd give you what was reasonable and they'd figure it out later.
yeah,
I mean, you know, it's like 4 months. You know, for us, I think finding a place to I don't know what we had done if we didn't find these two places. I mean, that would have been really, you know, we have a different place in the free clinics now and we're renting the space. But I mean, everyone else is still running their business. I mean, they were doing 2 year leases. They let us have 1 year, so that was really nice. I mean, we looked at Advent Health, which HCA is, I mean, and HCA, which is up bought Mission, and it's all for profit. I mean, they're looking at you and then like you're gonna be paying this much rent, and you're gonna have to fix everything else yourself,
yeah.
and you're like, we have no like cash flow. So I mean, it's those kind of things in place would help, you know, to have stuff. I mean, I think a lot of times with doctors, people are like, oh, they have all this money and they're
Mm,
fine, you know. So maybe, you know, I mean, my focus is on other people who's in
right.
families who are like suffering worse than we are, but at the same time, I think we can have some better structures that can come in place. I mean, FEMA's there, but they definitely get overwhelmed with the amount.
Now, what about the other medical practices in your area? How are they faring in comparison to how you
So
guys
in
are doing?
our Beverly Hanks, where our office is, there is dentists are in that area. And I mean, I actually have one of my close friends who's a periodontist, and they've they've reached out to other dentist office that they aren't using their space at certain
Sure.
times. So they've been able to work that way, you know. I'm like laughing because I'm like, dentists don't work on Fridays, so
Yeah.
these offices all have places to work on Fridays. But I mean, it's very disruptive too. There was Allergy Partners was next door to us, and but their main office is in Nashville. I mean, this is kind of satellite office, so they have other offices that they
Sure.
can, yeah.
Now, you mentioned that you receive support from the North Carolina Medical Society. Do you feel that
Yeah.
you receive the appropriate support from your fellow colleagues or fellow medical colleagues in the community?
I mean, that's a good, I wasn't expecting that. I think what's hard is like people call you or talk to you and they want to help, but what are they going to really do?
Yeah, yeah,
I appreciate it, but it's hard. It gets down to it. It's like, I mean, we have to do this stuff, we have to be the ones. Yeah, money definitely helps,
sure,
but because I think for us, money wise, we are as owners, there's how many owners now? 7 owners.
sure.
And we're paying our employees first. We want to make sure. I mean, they really rely on their paycheck, every 2 weeks more than we do. I mean, we do, but we want to make sure they're taken care of. So, you're doing all that first. So it definitely helps to have that monetary support, and also the space. I mean, that, with Blue Ridge Health, I mean, we had the physicians there. They had built this space for pediatrics they weren't using. I mean, if we didn't have them helping us, it's just, yeah. So that kind of stuff helps, from the physicians.
Now, once you fully recover, hopefully later this year,
Yeah.
any changes that you're going to make to your practice just in case something like this happens again in the future?
Yeah, that's hard, right? Well, we have talked about moving our office in Hendersonville,
Yeah,
because regardless if this is, they say, 1 in 500. I mean, they say 1 in 500 years because the whatever we are is in this .2 field, whatever they
sure.
determine that. But, in reality, that could happen any year. Any year you can go and say, oh, that could happen again, even though you don't see that happening again, but you don't want to put yourself in that position.
Yeah.
It's kind of hard because we were actually building a different space in Brevard, like started in the summer for our clinic there. And so, I mean, all our resources, I mean, we didn't have the money to be able to start even thinking about doing a different office in Hendersonville now. Sometimes a lot of people are surprised, like, are you going back there? And it's like, well, we don't really have a choice because we can't do this for 2 to 3 years as we find a space to be able to build an office as big as we are. We're not just one little clinician. We're like 4 of us and seeing
Yeah.
100 kids. I mean, that's a big space. And to find that space and build it, it's going to take time.
We're talking to Derek Moss. He's a pediatrician, and today's Kevin MD article is How Natural Disasters Reveal Resilience and the Power of Community. Derek, let's end with some take home messages that you want to leave with the Kevin MD audience.
I know you sent that to me in email, and I was trying to journal something down in my take-home message. I know, I think it's interesting how like different people interpret my article. They'll say different things to me. I mean, how you titled that. I mean, it is very true, and I hear that a lot. I talk about I never know how to say it myself. I've lived here for 20 years, but to say it Appalachia or Appalachian, but the people here are very strong and resilient, and I mean, it is the community that holds us together. So I think we kind of can forget that in the world that we live in because, so social media and the internet, and we're all interconnected with the world, but you're still where you live. And the people that are here are they're proud and strong. And I think, you know, get all emotional about that, but I mean, there's truth to it. I think things happen to us. You hear in the past, like things happen in the United States, and we bounce back and get strong or stronger. So that does occur. You don't want to have to go through this, but That is, I guess, the gift that's there if you're open to it.
Derek, thank you so much for sharing your story, time, and insight. And thanks again for coming on the show.
Oh, thanks, Kevin. It was nice meeting you.